Ned's not as shameless as I am. Competition, perfect score is 10. Worst score is 90. We got an 11 under Ned's leadership. We really are among the best in the world in creating knowledge and taking care of patients. The second non-shameless import is the return on investment. Yes, we've been given a tremendous largesse from the state of $400 million, but we're running about $6 to $1 return on that investment each year because of the increase in grant funding and small companies and other things that are being innovated, inventive, and done at the Cancer Center. So we couldn't do it without the people in this room. Kirk Bradley and Doug Anderson and now Dual Comfort have joined us, and they've actually paid for your meal, so do thank them when you see them. They make this happen every year. But the state has been remarkable. And that's kind of one of our themes in a tangential way. We're a public comprehensive cancer center, and we need to take care of the state of North Carolina. It's a great laboratory. It goes from the sea to the mountains. It has all forms of socioeconomic pockets. It's rural, it's agricultural, it's manufacturing. It's a great place to try to understand cancer care in America. But one of the things that's important about North Carolina, very important historically and now, is our commitment to the military and the military's commitment to us. We have two of the largest bases in the world here, the Marine base and the Army base, and we're going to hear from one of those constituencies. This is something that I don't talk about very much, but I am a retired major. I was in the Army Medical Corps during the Vietnam War. I did not deploy overseas, and our speaker did 3 times, and he's going to tell you about that today. But I did get to know the wonderful people in the military and the social aspects of how they help each other, the officers and the enlisted people. It really is a family. I'm a little worried with budget cuts that we're losing some of that nationally, and so it's really important for the state of North Carolina to draw our military in and to take care of them. The medical school has done a great new thing in starting a PA program, which is going to be directed towards medics, like the person we're going to hear about. He skipped over that. But it's really important that we be able to offer our military personnel the world's best care. They may not get it in the VA, although the VA actually I think does a great job, but we need to be here for our soldiers and their families if something happens. And you're going to hear a great story today from Eric Strand. Eric is someone who is now about to enter his 4th year of UNC Medical School. That's the end game. The beginning of his story is when raised as an Army brat, he decided to drop out, couldn't find a good job and joined the military, ended up as a medic in the Special Forces. He will tell you that story. He will tell you how that influenced his life. And then he'll tell you of something that happened to him as a young man. Something that we're very interested in, cancer in the young, because it isn't always obvious. We don't detect it as well as we should because it always comes as a surprise. And Eric's story is part of that. But it has a wonderful, happy ending. And I will stop and introduce Eric Strand, Special Forces graduate, retired, a medic, now a medical student, and a cancer patient at UNC Lineberger. Eric?
Thank you so much for that generous introduction, and thank everybody for having me here on this wonderful day. And I would specifically like to thank everybody for whoever it is that turned on the weather machine and made it such a lovely day for a basketball game. So the thing I wanted to talk about today is second chances. And it seems like it can be a very cliche thing to bring up. And I kind of want to drive home the point that when we think of it as being cliche, we miss how many things have to go right in order to make a second chance work. I think a good way to introduce that is to talk about the a cappella group today. You see that you know when it goes right, but you don't see how many things have to come together to make it go right, but you definitely know when it goes wrong. So I kind of want to drive home the point that maybe second chances are a little bit more than a cliche. As Dr. Earp mentioned, I was a bit of a misguided youth, and I decided it would be in my best interest to not finish school in 10th grade. And I spent a few years when I was 16 loafing around trying to be a cool kid, which landed me in the only job I could get after a string of bad employment at a steel mill. Turns out it was not a very good place to work and to grow a life. I spent a few months there, and the first time I got burned, so working at the first place you start in a steel mill is a place called Shakeout. They pour the steel molds, and they go through a tumbler, and then the slag, which is all the additional stuff that's stuck on the parts that you're manufacturing, is supposed to fall off as it goes to the tumbler. Then a certain amount of hot steel comes out on a conveyor belt that has some slag attached to it. So the shakeout guy, his job is to take an 8-pound sledgehammer, hit the slag off, throw it over your shoulder into a bin behind you. Mind you that the metal is still a little bit red at the center, and you're wearing large leather gloves up to your elbows, a big apron, and a respirator. So after my 6 or so week, working third shift, 13 hours a day, hitting metal with a hammer, my gloves slipped down, and a piece of the metal came and slipped and hit me in the arm, just briefly enough to make the sound you make when you put a steak on the stove. It wasn't a bad burn. I didn't have to go to medical care for it, but I was sitting up in the break room pondering what I was doing with my life when somebody walked in and he said, "Oh, I got your first burn, huh?" This was down in Alabama. Said, "Well, you keep working hard here. Maybe after about 15 years, you can do like him and start driving the forklift." And this guy had one ear. And I started looking around the place, and they basically looked like alley cats because of how difficult and dangerous of a job this was. So I packed up my lunch bag and I walked out, and I never went back to that job. Unfortunately, it landed me in a position where I did what when we're young, we call couch surfing. I was the guy who was always asking to crash at a friend's house. They're like, yeah, I'll take you in. And 2 or 3 weeks later, they kind of gave me that look, "When you leaving?" It was bad. It was hard on my friendships. It was hard on my pride. I realized that's not the kind of person I wanted to be. So I ended up taking my GED and going to the Army recruiter with the hopes of being one of those people that does their 2 years and goes to college and gets a job, any job. What I found there was my first job was a counterintelligence agent. I honestly didn't like the people I worked with. I thought they were kind of shady, which the job description should probably have warned me. And I saw these groups of people at Fort Bragg, which was my first duty station, that I was very impressed with. And they were Green Berets. And I started thinking to myself, like, this is what I want to do. But I never thought I could do it. So on a whim, I fulfilled the application. I started going through the selection process, which is one of the hardest things I've ever done in my life. And what it gave me was the kind of challenge that a misguided young man needs to feel fulfilled. And it was a wonderful experience. Through 2.5 years of Special Forces training, I spent many long, cold nights being hungry and tired and feeling like I can't push forward. But I was surrounded by people that were still pushing forward that I respected enough to try to impress. That carried through the end of my training until I got to my first team. So the interesting thing about when you sign up for Special Forces is you just say, "I'm interested in these 4 specialties within Special Forces," and you list your preference, but you don't get to pick which one of the specialties you get. So you can either be an engineer, or a weapons sergeant, or a communications guy, or a medic. After the selection process, they said, "Hey, you're going to be a medic," and I said, "Okay." I guess I'll learn medicine. What I learned was that they had this immense reputation for being the best combat medics in the world. And I went through the training and I started experiencing a side of life I never thought would be attractive to me. So having this medical training and also being a Green Beret and showing up on a team, I met my first team in combat. And I remember I went through, and to go back a little bit, I started Special Forces selection in October of 2001. Now, my application was already in, and I already wanted to be a Green Beret, but I showed up to selection, and the commander of the training came out, and he said, listen, you're doing this right now because you are going to go to war. And that's how I met my team. I finished training, got on a plane to Fort Campbell, which was my first duty station, 5th Special Forces Group. I showed up, I checked into base, and they said, you're getting on another plane in 3 days. Got all my gear, didn't even finish in processing my unit, didn't even finish in processing base. Flew, I landed in Balad, Iraq, and the Group Sergeant Major came out, and there was a group of about 7 of us that had been in Iraq for exactly 6 hours that have never been to combat before. And he says, hey, which one of you are the medics? And 2 of us rose our hands, and he said, you guys need to stop dying. And I went to my first team, and I was replacing not 1, but 2 medics who were shot and sent home. So I had some big shoes to fill. I was the young replacement on a new team. It was literally trial by fire. I was in Mosul, Iraq, and I had to learn how to integrate with a new team, learn how to do my job, and learn how to do combat all at the same time. It was an awesome experience for a young man. It was some of the best and some of the worst times of my life. Came home from that deployment, did some training, brief turnaround, and I was in Baghdad in 2005, which for those of you who remember the news, it was some of the most busy times for that city. It was a very tumultuous deployment with quite a few big firefights and close calls, but we all came back, we all came home, nobody got hurt. As a medic, I saw some very large mass casualty events and provided care for those. Came home after that deployment, and with my previous wife I had married before I started training, had a daughter in between my second and my third deployments. My third deployment was much different because I was leaving somebody behind that I was worried I wouldn't come home to. It was a long deployment, and I was getting tired, and I was getting a little burnt out. Specifically, I was getting a little tired of always having somebody knock on my door when they had heartburn or an anxiety attack, or going out to the range and trying to teach Iraqis how to shoot, and they're showing me all of their various rashes and talking about their headaches. I felt like I was burning out on medicine. And I was doing a lot of intelligence work at the time, so I was kind of going through a crisis. Okay, do I want to go to college and join the CIA? Do I want to go to PA school? Do I want to just get some other random job? Do I want to stay in the Army and do 20 years? As I was kind of burnt out at the same time. Started taking classes online. And I remember one day before we went on a mission, I had all my body armor on, I had my M4 in my hand, we had just finished doing radio checks and making sure the machine guns were working. And I called my captain, I said, hey sir, can you come do me a favor real quick? Can you proofread this essay before I submit it? And that's what a lot of my college was like when I was deployed. I was doing assignments, I was doing reading, I was turning in essays and trying to get excuses from the school for when internet didn't work for 2 weeks at a time. That's how I did about half of my college. Because at that time, there was enough smart people that told me you can't do anything without an education. Not quite sure what I wanted to do with my life. We were setting off to do a patrol in a village where 6 Americans were killed about 3 days prior. And it was not a midday patrol to go shake hands and eat bread. It was the middle of the night. We wanted to kind of take a look at what was going on. And on our way, as we were crossing a ravine on a narrow crossing through the desert, the truck in front of us exploded. Our interpreter was killed. 3 of our guys were wounded pretty seriously, ended up having to give me a medevac. One guy had 4 spinal fractures. His night vision goggles were sticking out of his forehead. And the other guys had some shrapnel injuries and some brain injuries. About a month later, we had been tirelessly working to figure out who planted that bomb, and we figured out who it was. We planned an operation to send half of the team walking in to block off their route of escape while I was on the assault team to drive in and raid the house. As we were driving up on the assault team to get ready to enter the house, one of the members of the security team saw that there was a threat that we didn't see. So I was supposed to be the first one to go through that door to raid this house. Jason saw that there was something unsafe, and he ran into the courtyard and encountered a machine gun that was planted in the corner of the wall. He died instantly, and 9 people were wounded that day. So he quite literally traded his life for mine. Among the people that were wounded that day was the medic on the team, Mike. There were 2 medics at the time. He was a guy that was everything that I wasn't at the time. He was fresh. He was a very professional medic. He was a medic in the Army before going to Special Forces. He ran an emergency room as an enlisted man. And very organized, very professional, very not burnt out. And I respected him a lot. He had a grenade land about 4 feet to his right, and he was taken out of the fight right away. And I was put in this position of having this person that I respected professionally, that was a close friend of mine, and telling him, Mike, you're done. You're done for the day. Took away his radio, took away his gun, taped a fentanyl lollipop to his hand, and sent him on his way. And I didn't realize how much that would inspire me until we'd returned from that deployment. And one of the first things we did was make a trip to DC as a team. So the 12 of us loaded up into a 15-passenger van, drove up to Washington, D.C. to visit 4 guys at Walter Reed and 1 guy at Arlington. And Mike was one of those guys at Walter Reed, and he was sitting there telling me over dinner, he said, Eric, I'm glad it was you that day and nobody else. And that's when I started feeling passionate about medicine again. Some other people along the way planted the idea of, well, maybe you can go to medical school, maybe you can go to PA school. Medical school wasn't a big route for enlisted military people at the time. But there were enough people that planted the idea in my head along the way that I said, well, maybe I should just try. So I got a job at Fort Bragg teaching the Special Forces medic course. Around that same time, my marriage was failing and I got a divorce, which is kind of the norm for that career field, because I wanted to start going to college full time and maybe explore the idea of going to medical school. I had to get my pre-med requirements, which is really hard to do online from half a world away. Campbell University has a campus at Fort Bragg where they teach their science courses out of the facility where I was teaching. So it was a very convenient situation for me. I was able to go in the mornings, take the students, run them, have them do log PT, fighting, whatever, from 6 to 8 in the morning, and then from 8 to 5 I was in the OR teaching. Had about an hour for dinner, and from 6 to 10 p.m. I took my classes at night in the same building I worked. It was a pretty sweet deal. Also, right when I was showing up, UNC had just signed an agreement with Special Operations Command with Dr. Cairns from the Burn Center to start a program where medics could start rotating at the UNC Burn Center, which is something we have to do to keep our credentialing, but he, being kind of the sneaky man he is, he wanted to sneak in an opportunity to try to bring people like us into the medical field. After I did my first rotation up at the Burn Center, during which I met a beautiful research fellow that I fell in hard enough love with that it overcame my cynicism at this point. And I took over that program as the clinical coordinator. I eventually wore down this beautiful research fellow to the point where she would start dating me through persistence and persistence alone. And things were starting to look up in my life. I was feeling inspired enough to apply to medical school. The end of college was starting to become a light at the end of the tunnel, and I was doing my applications and having a normal relationship when she took me on a trip for my birthday to Wilmington. Problem is my birthday is in January, so we still wanted to go to the beach. I think she was writing a grant at the time, so she was halfway freaking out about the grant, halfway trying to give me a nice birthday. So we were at the beach on a cold day. My truck was stuck in the sand, and I was talking about this pain I had in my arm. I said, well, I don't know if I've been working out too hard. I don't know if I've been, working out wrong. I don't know what's going on. I just have this pain and snag, and it's been going a while. And she's like, you got to get it checked out. I'm like, well, and she's like, your arm feels hot. You got to get it checked out. And she kind of started nagging about me needing to get that arm checked out. So I did exactly what any bad patient would do. And I just went to the PA who was my course director, and I said, hey, can you take a picture of this? And he did what any half-hearted PA would do, and he just scheduled me for an MRI without any other consultation. It was at my behest and somewhat pressured by me. So I went in, I showed up for my MRI about 2 days later at midnight. I went through the machine and learned how much of a poker face MRI techs have when they don't want to tell you something. And the next day I went to work, and he just kind of slid me a report that said suspicious for osteosarcoma. So I kind of looked at this piece of paper. Now, granted, this is not how medical care is supposed to be delivered, but this is what happens when people think they know better and they try to backdoor everything. So I'll take the fall for that one. Looked at this piece of paper, kind of choked back a tear. Went up to my office, tried to, not make it look like anything was wrong. I'm just like, I'm gonna get a coffee. And I got into my truck and I just drove around the block over and over again, crying, wondering if my kids were going to lose me after all the time I spent not dying in Iraq. My wife was studying for her in-service exam at the time, and we were dating. We were not married yet. Studying for her in-service exam, and she was really not to be bothered with a lot of things. And she was wondering why I was blowing her phone up, and I said, I have to come over. And I came up, and that night we drank a bottle of wine and cried like idiots. I came up to UNC, to the osteo-oncology department with Dr. Esther. He took some biopsies, and they took a core biopsy, and he said, well, it's not osteosarcoma. We think it's an infection. And we felt great. I felt stupid for being so sad and crying so much. And we kind of started moving forward with life in general, and we celebrated by going to Puerto Rico for her birthday to meet her family. So her extended family lives in the mountainous areas in western Puerto Rico. Had such a wonderful time. I was not planning on proposing, but I couldn't help it. And she knew something was up, because on the last day of the trip, it was a 7-day trip, I'm sitting there and I'm not talking to her at all, and she was getting mad. She's like, why aren't you talking? Why aren't you talking? And I'm like, And finally, we're stuck in traffic in San Juan, and she says, you have to tell me right now what's going on. And I said, I'm afraid to open my mouth because I'm going to ask you to marry me. And she said, turn the car around, go back to the hotel. So we dressed up, went to dinner. I walked about 4 steps behind her, and she's like, what's wrong? I was like, I'm embarrassed. Didn't say much for dinner. We had a nice dinner, and then we were walking back to the hotel, and she was like, so you gonna do it or not? So here I was. I didn't have cancer. I had 2 semesters left of college. I had my MCAT scheduled. Took 2 weeks of leave from the Army to study for my MCAT. Came up to her house. We were now newly engaged. We're gonna have a wedding in 2 years. Plan it well, do it nicely, do everything traditionally. And I just kept on getting this call from Fort Bragg over and over and over. I'm studying for the MCAT. I'm not taking any calls. I'm not dealing with anything. As soon as I take my test, I can deal with stuff. It was the clinic from Fort Bragg. So finally, I'm like, okay, what is this? I finally answer one of the voicemails, and it just says, you have an appointment at UNC. I said, okay. Again, this is my fault. I go to the hospital. I check in at the women's hospital entrance, and I said, hey, I have an appointment here today. I think it's with infectious disease, because me being in the military, as soon as it was not a bone cancer, they thought it was either syphilis or TB, because I'm in the Army. So I figured I was going to go to the infectious disease clinic, and I said, oh, your appointment's in the cancer hospital. I said, okay, maybe the infectious disease clinic is in the cancer hospital. Walked over to the lobby, picked my number, checked in. She gave me a folder, take upstairs to the 2nd floor. Walked into the 2nd floor, and the receptionist says, do you have a port? And I'm like, what's a port? And she's like, are you getting any treatment? I'm like, no, I don't know why you're asking me these questions. So I go, and it says multidisciplinary clinic. I'm like, this is the perfect place for an infectious disease clinic to be. I walk back, I'm sitting in the exam room. Somebody walks in and she says, hey, I'm the oncology fellow. And I said, why are you the oncology fellow? And she said, I'm here for your lymphoma. And I just said, what? And she said, you didn't know? And my wife at the time was teaching med students. And I just texted her, I have lymphoma. And I saw the little 3 dots on the bottom of the phone for about 20 minutes. So, needless to say, this threw everything for a loop. They needed to get a bigger piece of tissue, so they ended up taking out a nice big chunk of my ulna to the point where they had to replace it all with hardware, figure out what kind of lymphoma it was. I couldn't do anything because I was right-handed, and I had surgery on my right forearm, so she had to cut my meat for me. She had to turn on the shower for me in the morning. This is somebody that we were dating and just became engaged, and she's making this decision, this very difficult decision to say, like, okay, I'm in it. And I don't think a lot of people would do that with somebody they just got engaged to, because I think there's a lot of better options out there than somebody who's just been diagnosed with cancer. They figured out it was diffuse large B-cell, or they decided it was because it was so strange that it had to be that and nothing else. And they told me I was going to start chemotherapy on the 2nd of November. My UNC interview for med school was on the 7th of November, and I asked him if I could do it after that, because I didn't want to be the sick guy getting interviewed. Also around that time, I looked into fertility, and to not take any chances, I was going to see, okay, can I bank my sperm? Insurance would pay for that, but they wouldn't pay for IVF at the end. So she said, hey, let's just go to the courthouse, make it official, and then try for a baby. And a week later, we were pregnant. So I went to my interview at UNC for med school, and I gave them a lie of omission. I didn't mention anything about what I was going through because I didn't want the admissions committee to worry about me dying as a med student. I kept that to myself. The very next day after my interview for med school, I showed up for my first infusion. It was a 1-day infusion that lasted 3 days. I was one of the number of people who don't do well with rituximab, but I had to get it. So I got the dose of Benadryl that could kill a horse and the 8-hour infusion, during which the entire time I was terrified that I'm getting a medication that I'm allergic to. The next day, actually, important about that night is I ended up having an afternoon infusion, and I stayed until the wee hours of the morning. The infusion nurses are day nurses. They're not supposed to stay overnight. They're not supposed to work on the wards, but they stayed there and kept a fantastic attitude while I am the one guy that's keeping them from going home. And they actually decided not to admit me and just stick around and hang out with me until I got that infusion. Next day I came in, so I was a young guy, great veins, that's what they said. Still getting everything peripherally. I went in to get my doxorubicin and vincristine and everything else the next day. Doxorubicin is a very toxic drug to tissue. And as I was getting my infusion, I felt a tremendous pain in my arm. Actually I can call her my wife at this point in the story, was a burn research fellow training to be a burn surgeon, and she knew exactly what was going to happen. And she sat there in stunned silence as the plastic surgery team came to look at my red swollen arm and figure out at what point all the skin was going to fall off. Amazingly, the pharmacist just happened to hear what happened, and he came down, and he's like, whoa, 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 whoa. There's a drug for that now. He came down, he brought down all the articles, showed all the physicians everything that he knew, and he said, this is how you give it, this is what you got to do. They administered basically the antidote for what we called an anthracycline extravasation, and completely saved my arm. That's the part where multidisciplinary care, I think, is an amazing, amazing thing that makes cancer care work the way it does. Needless to say, they decided they were going to put in a port. I got my port the next day and then finished my infusion. So my 1-day infusion was 3 days. And I didn't feel terrible. And I said, you know what, this is easy. And there was this Mexican restaurant in Carborough that we always wanted to go to, so we went, and I pigged out, and I'm like, oh, this is fine, this is nothing, I got no problem at all. And then that night, around 10 o'clock p.m., I spent the next 6 hours throwing up in the toilet. Overall, I would say chemo is as hard as chemo is. As I was going through my rounds of treatment, I would say that if I saw myself in clinic, I would think I was doing well. Clinically, I looked well, my labs were always okay. I felt miserable. I think it's really hard sometimes to realize how difficult it is when somebody looks well. Had one little bout of the flu that got me admitted, and that was a bit of a cluster as well. The emergency room, if you go to the emergency room with a fever and you're on chemo, you get the full meal deal. You get every image that they can take. They take blood from every place they can take blood, and they just slam you with the hardest antibiotics they got. That's when I learned I was allergic to vancomycin. And they started the vancomycin, walked away to do other ED things for the whole rest of the night, and I'm pushing my nurse call button and nobody's coming. Unfortunately, my port was tethered to the IV pump, which was tethered to the bed. So I stood up, I unlocked my bed, and dragged my bed out into the hallway when the nurse wasn't coming. And somebody turned and looked at me, and at this point I was completely bald because my hair had already fallen out, and I was red from head to toe and swollen. And they just said, you need to lay down right now. I mean, it's easy to understate these things. Oh, he's allergic to vancomycin. When doctors talk about this stuff, it seems pretty kind of blasé. Aside from that, it was generally uneventful. I was very tired, very scared. I used what little energy I had to drive from Chapel Hill to Fort Bragg to continue going to class twice a week, because in December I was accepted to med school, but I had to graduate on time. So I still finished my last 2 semesters of undergrad while I was on chemo. Finished my chemo, went to radiation, did my 6 weeks of radiation, which is a lot easier. On my last day of radiation, for those of you who have done it, they give you this little card. I forget what the card is actually for now, but you put it in a slot, and you ring the gong at the end, and you walk out, and people clap. I walked out of the hospital, and it was great, and I kind of walked out, I'm like, okay, what now? I didn't have much time to ponder that because my wife called me. She said, listen, I'm in the hairdresser right now because I'm in labor. She was going to be her mom was going to be really mad if her hair was messed up for the pictures. So as soon as she knew she was in labor, she went to the hairdresser first. So I didn't spend much time out of the hospital that day. I just turned right back around, and that day we had our daughter, Adelisa, on the last day of my treatment. So things were good. I had a summer to spend with my other 2 kids from my previous marriage. Started med school in August, and I was at the same time being retired from the Army, medically. And it seemed like everything was wonderful and good, but there's also this part about what happens afterwards. And I think part of being a survivor is always having to overcome the delusion that you're always dying. And there are some days you totally forget it and it fades into the background, and then there's some days, especially when you're going through medical education, that you're reminded of what could always happen. There were days when we did our hematology-oncology block where I was like, oh yeah, diffuse large B-cell has a 60% overall survival rate. That's amazing. I'm just like, it doesn't sound good to me. Even calculating my own survival, I went home and I looked at the thing, I'm like, oh, I'm 80%. That's still not a very high number. And, it's kind of like this, I should have had more practice in dealing with uncertainty with all the time I spent in combat, but it's still something I think everybody carries with them for the rest of their life. And it was even more apparent when I rotated as a medical student through the inpatient hematology-oncology service, and I would see people come in every day with recurrent diffuse large B-cell lymphoma, and would walk into their room, and I would just say, this could be me one day. Interestingly, another thing I learned on that rotation, though, is that when we talk about what makes a good hospital, what makes a good staff. And, you know, people think that buildings are kind of, for lack of a better pun, window dressing. Those rooms are amazing, the inpatient rooms there. And it is so good for patients' health to be able to see the outside world and to see day-night cycle. And those little things that people think are just fancy and frivolous are actually really, really good for patient outcomes. Because the way traditional hospitals are built is, we call it deliriogenic. They get delirious and it increases their chance of mortality to 60%. And all those little things that come in, the research that created the drugs that changed my disease from one that was almost uniformly fatal to one that has a, not high enough for me, 80% survival, to rooms that keep patients from getting delirious, to hiring quality staff that will stay up all night with you when they would rather be going home. Those are all the little things that we're always grateful for, because it takes a lot of things to give somebody a second chance, and a lot of things have to go right. And I think that, you know, to end with, second chances are very important because it answers the question. If you think about all the things that have to come together to give somebody a second chance, it answers the question, is my life worth living? Thank you.